Good morning and welcome to the second of a series of classes on anesthesia and intensive care. My name is Dr. Sharath Krishnaswamy and I'm an anesthesiologist and an emergency medicine physician. Today, we shall ask ourselves questions on how to approach an unconscious patient. What are the reasons for which a patient may be unconscious? The class has the following modules. It contains the neurologic causes for loss of consciousness, toxic causes for loss of consciousness, and metabolic encephalopathy. This class is open to doctors working in the ICU as well as non-medics who are interested to understand the reasons why a patient may be unresponsive or unconscious in the ICU. There are times when a patient is admitted to the ICU, and there are times when you aren't allowed into the ICU to see the patient. It may come across as distressing to you, but the entire stay of the patient in the ICU is a crucial time for the patient as well as the doctors who monitor the patient at close quarters. A person who tends to lose consciousness before being brought to the hospital may be due to many causes. It is important to identify what the patient was doing before having lost consciousness. Was the patient consuming a liquid or an illicit substance? Was the patient consuming excessive quantities of a normal foodstuff or liquid? Did the person have a fall that was witnessed or unwitnessed? Did the person face a trauma a few days before falling unconscious? Are there fang marks or insect bites on the patient? Or was the person unusually distressed by an insect bite or animal bite? Did the person consume a new medication or miss taking his or her medication after a long time? Whatever the cause, it is important to ask the following questions to the patient. If the patient responds, or the people who have been in close proximity to the patient. Has the patient had headache or vomiting? Has he had decreased hearing or problems with maintaining balance? Has he had fever, neck stiffness, or drowsiness? Did the patient have decreased sensation over the face or drooling of saliva from the angle of the mouth? Does the patient have any limb weakness or memory deficits? Does he have slurring of speech or clumsiness while performing his daily activities? What are the other conditions that the patient has? Does he have diabetes mellitus, hypertension, tuberculosis, thyroid problems, or a previous heart ailment? Generally, a sudden incident of great alarm is a result of a pre-existing condition that has worsened. So this is the reason why physicians and emergency medicine doctors ask about the past history of medical conditions of the patient. Has the patient undergone a surgery recently? Have there been any immediate complications of the surgery like bleeding or the patient falling unconscious or having to be taken back into the operation theater soon? Unconsciousness may also follow any incident that might have occurred in the operation theater or the ICU previously. Why would a person lose consciousness? The brain needs a constant supply of glucose and oxygen in order to function effectively. The moment either of this is decreased, there can be a condition called neuronal dysfunction. This may be due to a structural or a non-structural brain disease. When the brain matter is being compressed by a focal pressure on the brain, nutrients such as oxygen and glucose are blocked and don't get delivered. A few examples of such phenomena happening are trauma to the head, like an accident, blunt trauma to the head, or a sudden acceleration or deceleration injury. The brain tumor bleeding into a brain, a block in the outflow of blood from the brain, or increase in the cerebrospinal fluid in the brain. The cerebrospinal fluid or the CSF is the liquid around your brain and the spinal cord. An increase in the CSF or the improper exit of the fluid from the brain leads to a condition called hydrocephalus. Hydro is water and cephalus means head. This leads to an increase in pressure in the brain and hence causes a decrease in consciousness. The other set of causes as to why neuronal dysfunction can happen may be due to non-structural causes such as the effect of metabolites and toxins. The fluids inside the body have ions and chemical compounds that are at a certain concentration. in the blood and the brain tissues, the moment there is some disruption due to internal or external causes, the balance is lost. And this leads to the patient having a decrease in consciousness. Some of the examples are changes in the level of sodium in the blood or the levels of glucose in the blood. Let me now explain to you the neurologic causes for a loss of consciousness. The brain is a structure composed of neurons. A neuron consists of a cell body and the axon and dendrites. The cell body maintains the neuron structure and provides energy to drive the activities. The axon carries the nerve impulse or the electrical signal from the body to another neuron via a connection called the synapse. The cell body is gray in color, and the axons covered by myelin sheaths are white in color and hence called gray matter and white matter respectively. Now, all of the neurons in the brain are covered by layers of tissue called the meninges. They are the dura mater, the arachnoid matter, and the pia mater. Let's suppose due to trauma there is bleeding above or below the dura mater. This is when it is called the epidural or a subdural hemorrhage. If bleeding occurs inside the brain, it is called an intracranial hemorrhage. In other cases, when there is a sudden acceleration and deceleration, the brain rapidly shifts inside the skull as injury is occurring. The axons, which are the long connecting fibers in the brain, are sheared. These lesions are scattered and occur over a widespread area in white matter as well as gray matter. It is one of the major causes of unconsciousness and occurs in about half of the cases of head trauma. This diagram here explains to you the different types of hemorrhage that can happen. If it can happen above the level of the dura mater, it is an epidural hematoma. If it occurs below the dura mater, it is known as a subdural hematoma. If it happens below the arachnoid matter, it is known as a subarachnoid hemorrhage. And if it happens inside the brain, it is known as an intracerebral hemorrhage. This is the diagram that explains to you a traumatic brain injury. The neurologic causes, as I have mentioned, can be due to trauma, can be due to tumors, can be due to disorders in the vascular system in the form of a stroke. A stroke can be either ischemic stroke, where blood supply is stopped from reaching the critical areas of the brain, or a hemorrhagic stroke, where there's a lot of bleeding into the brain. Hypoxic ischemic encephalopathy, where hypoxic means less oxygen, ischemic means less blood supply, and encephalopathy means the disease of the brain. And infections also can happen of the brain, which are known as meningitis, encephalitis, or the effect of the bacteria or certain microorganisms which cause the production of pus inside the brain, causing a brain abscess. Here's a diagram that explains to you the difference between a meningitis and an encephalitis. A meningitis is inflammation of the coverings of the brain. An encephalitis, commonly caused by certain viruses, occurs inside the brain. Now let's say these layers of the brain, the meninges are infected by a bacteria or a virus. Then this condition is known as meningitis. When there is an inflammation of the brain tissue, it is called an encephalitis. When the bacteria infects a small portion of the brain, pus forms and collects in a small space. This is known as cerebral abscess. This is another cause of a fall in consciousness. Cancer of the brain can increase the pressure of the brain tissue inside the skull. There may be tumors that primarily rise inside the brain or may be carried forward by the blood from another tissue and spread to the brain tissue. This may cause a decrease in consciousness. There can also be complications where the blood supply of the brain is affected. The stroke is called a CVA, which means a cerebrovascular accident. This is when blood supply is blocked by a clot in the blood vessel of the brain called an ischemic stroke. Or there can be a sudden tearing of the blood vessel or an artery supplying the brain tissue, and bleeding may occur, called a hemorrhagic stroke. The bleeding may either be due to high blood pressure or due to a trauma or a road traffic accident. Another condition where consciousness can fall is called the hypoxic ischemic encephalopathy. Hypoxic is less oxygen, ischemic is inadequate blood supply, and encephalopathy is disease of the brain. Reasons for which this may occur may be due to strangulation, hanging, choking, and drowning. Brain cells are extremely sensitive to oxygen deprivation and begin to die within 5 minutes after oxygen supply has been cut off. When hypoxia lasts for longer periods of time, it can cause coma, seizures, and even brain death. The brain constantly generates tiny electrical impulses in an orderly pattern. These impulses travel along the neurons and throughout the whole body through neurotransmitters, which are chemical messengers. When the electrical rhythms tend to become imbalanced, they manifest as seizures. In patients with seizures, the more normal electrical pattern is disrupted by sudden and synchronized bursts of electrical energy, and this may affect their consciousness, movement, or sensations. What may happen after a seizure occurs is called a post-ictal state. The post-ictal state is an altered state of consciousness after an epileptic seizure. It usually lasts between 5 and 30 minutes, but may sometimes last longer in the case of larger or more severe seizures. And it is characterized by drowsiness, confusion, nausea, hypertension, headache or migraine, and other disorienting symptoms. The patient may also have moments of amnesia or memory loss after the seizure. During this period, the brain recovers from the trauma of the seizure. As I have told you before, the cerebrospinal fluid, or the CSF, is the liquid around your brain and the spinal cord. An increase in the CSF or the improper exit of the fluid from the brain leads to a condition called the hydrocephalus. Hydro is water and cephalus means head. This leads to an increase in the pressure in the brain and hence causes a decrease in consciousness. Now moving on to the toxic causes for loss of consciousness. The other set of causes can be the result of ingestion of drugs. One of the possible drugs that drug addicts tend to misuse or overuse are opioids. Opioids are drugs such as morphine, heroin, and fentanyl. There are other similar drugs using the same or the modified compound, but they all work in a similar manner but differ in potency. A drug addict can be brought to the emergency or the ICU unconscious. How would a recreational or an illegal drug cause unconsciousness? Here I'd like to tell you about how the opioid acts. Like I mentioned before about the neuron, there are two neurons, a presynaptic neuron and a postsynaptic neuron. The presynaptic neuron releases a neurotransmitter which travels from the presynaptic neuron towards the postsynaptic neuron. And this is how a nerve impulse travels. The opioid tends to prevent the release of the neurotransmitter in the presynaptic neuron, and it has an inhibitory action on the postsynaptic neuron, which means an action potential is not generated. and the nerve impulse does not travel further. So in effect, the opioid causes the person to breathe much slower than they do and also cause the patient to feel extremely sleepy. There are occasions where the opioid causes fainting too. The other set of drugs or medicines that can cause a fall in consciousness of a person are called sedatives. These are the sleeping pills that the doctors prescribe in order to help the person fall asleep. Patients may take sleeping pills for various reasons, for psychiatric disorders, or to help them fall asleep due to changing work shift timings, or they may even consume tablets that don't belong to them. The most commonly used sedatives around the world are a class of drugs called benzodiazepines. Most sleeping tablets in the world are made of a similar or related compounds of benzodiazepines. How do these pills work? There are two types of neurotransmitters in the body. They are the excitatory and the inhibitory. These chemicals that either make you sit up, be awake, be excessively talkative, productive, and go on an overdrive, and the other set of chemicals that cause you to fall back, sleep, be lazy, and slow, and feel very lethargic. There are a set of neuronal transmitters in the central nervous system called the Gaba receptors. These belong to the second group of the above. Benzodiazepines and alcohol tend to act on the GABA receptors, which is inhibitory in nature and thus reduces the excitability of neurons. GABA produces a calming effect on the brain. These also cause the person to slow down his respiration and heart rate, decrease his blood pressure, and then slowly fall unconscious. There are other drugs that can cause unconscious by other mechanisms, such as cocaine and amphetamine, but they are better discussed in another class. The other class of drugs that can cause unconsciousness are antidepressants. There are certain neurotransmitters such as serotonin, dopamine, noradrenaline, which are released by the end of one nerve and received by the other. The phenomenon called as reuptake. The antidepressants inhibit the reuptake of neurotransmitters through selective receptors. Thereby, it decreases the concentration of a specific neurotransmitter around the nerves of the brain. A few of the types of antidepressants are TCAs, which are tricyclic antidepressants, and SSRIs, which are selective serotonin reuptake inhibitors. These types of antidepressants increase the neurotransmitters such as noradrenaline and serotonin in the synaptic cleft and help them act for a longer time. The side effect of these drugs is to cause sleepiness. Taking a lot more of these drugs may just push the person into unconsciousness. Like I mentioned above, there are a few other drugs that can cause unconsciousness. Antipsychotics, the class of drugs that prevent a person from hallucinating. Anticonvulsants, the class of drugs used to prevent a patient from having seizures. And paracetamol and aspirin too, when consumed in large quantities, cause unconsciousness, the details of which I shall explain later. Coming down to the metabolic causes. Metabolic encephalopathy is a term that you should remember. Encephalopathy literally translates to brain suffering. If the brain tends to be injured or causes to be affected due to disease, the brain is supposed to be in encephalopathy. This happens when there is a change in the way the brain works or the change in the body which tends to affect the brain. Let us discuss the first few factors that can cause encephalopathy. Now the brain has respiratory centers and circulatory centers that serve as controls. The respiratory centers decide when you breathe, how deep you breathe, and when you exhale. They are present in the medulla and the pons, which belong to the brainstem at the back of your head, just above the spinal cord. When you inhale subconsciously, it happens due to the interaction of gases within these respiratory centers. Oxygen in your blood needs to fall to a certain extent in order to stimulate respiration. This is a condition called hypoxia. The carbon dioxide also, when increased to a particular level, tends to stimulate respiration. However, when the brain does not get enough oxygen, its cells don't work properly, and hence the patient falls unconscious. This also tends to happen when the person inhales too much carbon dioxide, a condition called carbon dioxide narcosis. Some of the reasons why a person may develop carbon dioxide narcosis are overdose of sedative medications, such as narcotics, benzodiazepines, tricyclic antidepressants, stroke, and hypothermia. Carbon dioxide also helps to regulate the flow of blood in the brain. The moment the values of carbon dioxide are not in the required range, blood flow to the brain tends to get altered. When the carbon dioxide levels in the blood increase, it is called hypercapnia. During mild hypercapnia, the patient may only present with non-specific headache, mild difficulty breathing, increased breathing, or excessive sleepiness. As higher levels of carbon dioxide accumulate, patients can become delirious, confused, you can breathe a lot more slowly, and it can ultimately progress to coma. The treatment and management of all of these conditions can be explained in the next class. Just like how low oxygen and high carbon dioxide can lead to unconsciousness, the same concept is applicable for sugars in the blood. Glucose needs to be within a particular range in the blood. In a condition called hypoglycemia, glucose in the blood falls below a particular level, that is 70 milligrams per deciliter, according to the American Diabetes Association. In the case of hypoglycemia, the patient may present with the following symptoms: sweating, tingling lips, feeling shaky or trembling, dizziness, feeling tired, or fast or a pounding heartbeat, which is known as palpitations, becoming easily irritated, tearful, moody, or turning pale. If not treated, the patient may then get other symptoms such as weakness, blurred vision, difficulty concentrating, confusion, altered behavior, slurred speech, or clumsiness, like being drunk, feeling sleepy, or even throwing fits or seizures, and ultimately collapsing or passing out. This may result in the patient becoming unconscious. Alternatively, when the patient has more than the required amount of glucose for metabolism, it leads to a condition called hyperglycemia, which is commonly seen in diabetics. A hyperglycemic crisis may occur when there is an increase in blood glucose with or without an increase in the ketones of the blood. Now, what are ketones, and what is this condition called diabetic ketoacidosis? During stressful states of the body, or when there is inadequate insulin that metabolizes the glucose, the body tends to use fats for energy. So fats in the presence of stress hormones tends to break down into fatty acids and glycerol. Fatty acids are further broken down into a class of compounds known as ketones. This condition is called diabetic ketoacidosis, and one of the reasons why a patient may become unconscious. The glucose tends to enter the brain and gets metabolized there, leaving behind water. This causes the brain to swell, causing a condition called cerebral edema. This causes an increase in the pressure of the brain, which is known as an increase in intracranial tension, and it compresses the vital structures that modulate consciousness, breathing, and blood circulation. Once the vital structures are compressed, it leads to unconsciousness. Certain conditions like sepsis, which the body's increased response to infection, can lead to the patient become unconscious. Microglia are actually cells that cover the neurons. Once these are activated, the amount of blood reaching the brain can be affected. There is a specific part of the body known as the blood-brain barrier, which limits the certain substances from reaching the brain. Once this undergoes a dysfunction, that may be one reason why the patient may develop unconsciousness. Neurotransmission is a way by which signals are transmitted from one neuron to the other. Once this is altered, the patient may develop unconsciousness. Microglial cells are cells around the neurons that remove the damaged cells by eating them. Impaired cerebral perfusion occurs when the blood does not flow into the brain at a regular or normal rate. The blood-brain barrier is present to regulate the entry of substances into the brain. Once this is disrupted, substances that don't normally enter the brain enter inside it and disrupt the normal functioning of the neurons. This leads to unconsciousness. Other substances which alter the functioning of the transmission of nerve impulses in the brain occur during sepsis. This further leads to the patient becoming unconscious. Sodium is an important ion in the body. You must know the difference between an element and an ion, and most of the elements inside the body occur as charged particles known as ion. Sodium is the principal cation in the extracellular fluid, and its main functions are related to body volume maintenance, water balance, and cell membrane potential. Now, the amount of fluid in the body can be classified as in intracellular and extracellular. That is the amount of liquid inside the cell and the amount of liquid outside the cell. So sodium is an ion which is present mostly in the area that is outside the cell. It is also useful for maintaining the acid-base balance in the body, and it also helps in the nerve conduction. It helps to keep the volume of fluid in the body at a particular level, and it also decides the amount of water to be sent out or contained. It also helps to keep a balance between the acid and the alkaline status of the blood, and helps to conduct nerve impulses in the neurons. Once the value of sodium moves outside the required range, the patient may fall unconscious. The healthcare provider will need to manage the electrolytes in such a manner so as to make sure the value falls between the normal range. Once this is done, the patient may regain consciousness. Shock is another of the conditions why the patient may fall unconscious. A shock is a life-threatening condition where blood circulation fails to occur to an appropriate level. This may lead to inadequate oxygen delivery to meet the cellular metabolic needs and oxygen consumption requirements, producing cellular and tissue hypoxia. The building blocks of an organism are the cells. A group of cells together form a tissue, having a same function. Now, if the amount of oxygen reaching the cells and the tissue is less, that is when it is known as a cellular and tissue hypoxia. Now, a shock may be of different types, such as a hypovolemic shock, when there isn't enough volume of blood or fluids in the body. A distributive shock, when the required volume of blood in the body isn't at the right place, which may occur due to sepsis or an allergic reaction. A cardiogenic shock, when the heart's pumping capacity is affected due to injury to the heart or the structure surrounding it. An obstructive shock, when there is some block to the outflow of the blood outside the heart. All of these conditions may cause reduced blood supply to the brain and hence cause unconsciousness. You might have noticed that a few alcoholics tend to get unconscious after a bout of drinking. Chronic alcoholics have complex mechanisms by which they can get unresponsive. Alcohol affects the brain in several ways. It alters the membranes as well as the ion channels, enzymes, and receptors. Alcohol also binds directly to certain receptors such as acetylcholine, serotonin, GABA, and NMDA receptors for glutamate. Alcohol tends to affect a receptor called the GABA. GABA's effect is to reduce the neural activity by allowing chloride ions to enter the postsynaptic neuron. These ions have a negative electrical charge, which helps to make the neuron less excitable. This physiological effect is increased when an alcohol binds to the GABA receptor because it helps the ion channel to remain open longer and thus allow more chloride ions into the cell. Hence, when you have the patient who has less excitable neurons, the patient has a greater depression of consciousness. Just as much as an alcoholic drinks, he also consumes less food. This in turn causes him to absorb less nutrients and vitamins like thiamine. This leads to a condition called Vernix Encephalopathy. The person may have slurred speech, stumbling, falling, and uncoordination. He may have confusion and his eyes may show repetitive, uncontrolled movements called nystagmus. Thiamine is also known as vitamin B1, and it is a coenzyme that is important for certain organic pathways, and it helps as a central role in maintaining the cerebral metabolism. So in order to treat somebody with a thiamine deficiency or with Vernix encephalopathy and who's an alcoholic, the treatment should be prompt and the physician should correct the thiamine deficiency in the brain. Now, hepatic encephalopathy, as mentioned in this diagram, is a condition which results from liver failure. The liver metabolizes an ammonia, but once the liver fails, the level of ammonia in the body rises. The liver fails to clear ammonia from the blood and leaves the patient showing an altered consciousness. So this is experienced as the person showing signs of forgetfulness, confusion, and irritability. The first sign of hepatic encephalopathy is denoted by an inverted sleep-wake cycle, meaning sleeping by the daytime and being awake during the nighttime. The second stage is masked by laziness, lethargy, and personality changes. The third stage is marked by worsened confusion. The fourth stage is marked by a complete progression to coma where the person is completely unconscious. A similar set of phenomena is seen in a condition called uremic encephalopathy, in which there is an increase in the levels of urea in the blood. One of the few risk factors that may cause a person to develop hepatic encephalopathy are a few conditions such as TIPS, where there is a portal vein thrombosis. Portal vein is a vein that contains deoxygenated blood that is carried to the heart. Infections such as spontaneous bacterial peritonitis can lead to hepatic encephalopathy. Any acute kidney injury, electrolyte disturbances, particularly a decreased potassium, or a gastrointestinal bleed, or a decreased level of oxygen and an increased level of carbon dioxide are risk factors that may predispose a person to develop hepatic encephalopathy. Now that I have discussed the above neurologic, toxic, and metabolic causes of why a patient falls unconsciousness, there are other set of causes known as the endocrine causes, causes related to the secretion of hormones by the endocrine organs of the body. I shall talk about them in another class. The class that succeeds this is a class on how to approach and manage a patient who has a fall in consciousness. Thank you for listening to the class.